Good afternoon and welcome. My name is Judy Hackler. I'm the Executive Director for the Virginia Assisted Living Association, also known as VALA. So to be mindful of time, we will go ahead and get started in going over a few of the housekeeping announcements before we get into today's discussion. As with any of our meetings, we like to be mindful of the laws and applications that are covered and required with the state and also the federal government. So we want to be mindful of antitrust conversations. Of course, we don't expect today's conversation to go anywhere near antitrust concerns, but we just like to be mindful. Some housekeeping and disclaimers. Please mute your line when you're not speaking. If you're on the telephone, you can use *6 to unmute. You can also, on your computer, raise your hand to be unmuted by a host. And we also invite you to use the chat feature if you have any questions or comments. We do want you to be able to feel comfortable to share any comments or questions. And then if we don't get to them during the presentations, then we will have a moment at the end where we can also cover some topics. This discussion is being recorded and will be shared on VALA's Health Alert webpage for those to view after the presentation is over. Only those that are on the live portion of today's call will be eligible for continuing education credits. Statements and information shared are a work in progress and may change. So as with our other response efforts to COVID, we know that things can change, and we appreciate you being mindful of that and being adaptable. Continuing education, today's webinar has been approved by NAB for 1 participant hour, and so it will be available to those that submit evaluation and put their contact information on the evaluation form at the end. With your NAB number, we will be able to upload it directly to NAB as well as send a certificate of participation to you. Only registered participants will be able to receive the NAB credits. And again, there will be an evaluation sent after today's presentation that we ask you to complete. Even if you're not requesting CEUs, we do ask that you complete the evaluation so we can use it to improve future trainings and discussion topics. A few resources in the email reminder of today's webinar. You should have received a link to today's slides, and on those slides should be clickable links. If you are unable to click on the links, you may also contact me. My information will be at the end of today's webinar, and you may be able to ask for additional information on any of these resources, and I'll be glad to send it to you. A few resources just of note is the VALA Health Alert webpage. That's a special page dedicated on the VALA website for information regarding the COVID response. Also available is the Virginia Long-Term Care Task Force webpage. That is the task force that was created by the governor in partnership with the Department of Health and other agencies. VALA is a part of the task force. Also a link on there is the link to the Department of Social Services with some resources available for assisted living facility providers. Special guests, I want to welcome from the Virginia Department of Medical Assistance Services, Thomas Gates, the Senior Advisor for Finance and Technology, and Bill Lassard, Director for Provider Reimbursement Division. From Jackson Lewis PC, we have Courtney Malveaux, Attorney at Law. The preliminary discussion agenda, I'm going to go over a few items regarding reopening updates, personal protective equipment, funding opportunities for assisted living communities, Department of Labor and Industry's workplace safety standards, and any additional COVID items that come to mind by participants or any of our guest speakers. So just a couple items to go over quick updates. If you have not seen it, the Virginia Department of Social Services has released tips and best practices for reopening. On their website, there is a link that you can click on, and it has information with regards to communal activities, transportation, COVID-19 mitigation plans, barber and cosmetology services, communal dining, and reopening to visitors. And I want to apologize if there's any breaking up with regards to our internet connection today. We are starting to experience an electrical storm outside of our office, so I apologize, and we will try to do our best. If you miss any parts, you may also use the chat function to ask any questions. If you need anything repeated, please be sure to do that. We want to make sure that you get the information And again, these slides are downloadable on using the link in the email that was sent to you. Personal protective equipment updates. Just want to remind everybody that there's two areas of importance with regards to posting your PPE supplies, your usage, as well as what's available to you. We have the VDSS is requesting that all assisted living providers to post every Tuesday by 5 p.m. what their usage was for the previous week. They are using those usage reports in order to determine where to send supplies in order to help providers. So if you are not already doing the weekly posting of your PPE usage, we invite you to do so and encourage you to do so. That way the Department of Social Services can get you supplies as needed. Also VHASS, V-H-A-S-S, it's a website from the Virginia Healthcare Emergency Management Program, and that is continuously updated and continuously monitored to also distribute supplies as available. The N95 fit test training, additional dates have been added and they are free training opportunities. So if your staff or anybody within your communities needs to be trained on how to do the N95 respiratory fit testing, then please look at those links to get additional information. Funding opportunities for assisted living communities. So as COVID continues to be a concern for assisted living, we are working with multiple organizations, multiple state agencies, as well as our national affiliate, Argentum, to try to get additional funding supports. Argentum's doing a lot of conversations and working with the Health and Human Services on a national level, and we're also working with the state. And so part of today's conversation is going to be covering what are some of the updates available. So I know we have Thomas Gates with us, so I'd like to turn it over to him to provide an update on Virginia's funding opportunities. Thank you.
Sure thing, and thanks for inviting me. Glad to be here to provide an update. Unfortunately, if you've been on some of the other calls on this topic, there's not a whole lot new today, though I think this week is going to be hopefully we'll have some more information to share by the end of the week. So I'll just step through this quickly and talk a little bit about more what to expect later this week when we get to the scheduled slide. So this is just kind of laying out what the eligible costs are for. Just to remind everyone, the kind of basic scope of this program is the federal government has provided Virginia with a bunch of funding under the CARES Act. And Virginia has allocated a portion of that CARES Act funding to supporting COVID-19 related costs in both nursing facilities and assisted living facilities. It's important to note that this is not really funded through the Medicaid program. DMAS is the state agency that's running the program, will be enrolling providers and making payments, but it is not a Medicaid program. So you don't need to be a Medicaid provider. You don't need to be enrolled in the Medicaid program. We are operating this and running this, but it is a state-run program. It's not Medicaid. It's just funded through the CARES Act. So these are some eligible areas. It's important to note that this isn't it's not funding like a rate where we would say for every day you get X dollars. It really is intended to be a reimbursement for shown expenses. So there are some caps that are calculated that I'll get to on the next slide, but the payments have to be based on demonstrated invoiced costs. So this is sort of a non-exhaustive list of potential expenses, but it gives you a good sense of the kinds of things that could be reimbursed. But again, it has to be related to COVID-19. So while we have employee benefits on here, you have to show that you had paid additional benefits or brought on additional staff because of COVID-19. It wouldn't be just for your basic running of your organization. So next slide. Thank you. So the kind of update here is the initial communication from DMAS will provide additional detail on this formula, but this is sort of the basics for how we're calculating the per facility cap for these reimbursements. And for assisted living facilities, that is basically, it's $4,000 per month for July, August, September, and October. So $4,000 for each of those 4 months for each facility, regardless of anything else. That's kind of the base. On top of that, there's an additional payment or an additional ceiling that's available if you participate in the auxiliary grant program. So if you have residents who are auxiliary grant recipients, for each AG resident per day, you'll get an additional $15 in that kind of calculated gap. So for example, if you had, you get the $4,000 and then say you get another, $2,000 worth of auxiliary grant ceiling, that would mean you could expense up to $6,000 worth of expenses for that month. And DMAS would make payments for that $6,000. So if you can show $6,000 or more in COVID-19 related expenses, we would pay them. If you don't participate in the AG grant program, that ceiling would be $4,000. And if you have more AG residents, it could be even higher. So that is kind of the basics for how we're calculating what we'll pay you per month. Next slide. Excuse me. All right, so this is just the kind of draft schedule. We are finalizing this probably this week, so this should nail down and stop being draft pretty soon. So far, we're hitting the mark. July 1 is the beginning of this program, so eligible expenses start in July, and we have gotten some questions around that because obviously the emergency declaration goes back to March, and people may have issues earlier than July. Because this is a finite program, it's just these 4 months. So if you have expenses that are from May, we can't reimburse for them. If it's from June, we can't reimburse for them. They have to be from July, August, September, or October. The week of July 27th, we were supposed to award our contract. We did. So we have brought on board Myers and Stauffer, MSLC, who are a firm that we work with regularly to do our cost allocations and cost settlements and a bunch of other work, mostly with nursing facilities and a bunch of our other kind of accounting provider reimbursement work. So they're very familiar with DMAS, we're familiar with them. I think the nursing facilities in particular are very familiar with them. I don't know if the assisted living facilities have worked with them in the past, but they're very competent at this kind of work. And they're helping us with the actual kind of intake of the invoices, review to make sure that there's proper documentation, and then providing that to DMAS for approval and payment. So they're kind of they're going to be the middle layer between the providers and DMAS actually making payments. In early August, we'll send out detailed communication. We're hoping to do that this week. We actually got a draft of the communication. We have a draft of the actual document or the Excel form that we will use for invoice intake. And so we're reviewing that now. It's going through our internal review and need to just make sure we're okay with how everything is structured. And so we're hoping, since we already have a draft, it's only Monday, that should go out this week. Worth noting, we have an email list, and we're planning to send this out on email. We'll post it online somewhere. We'll obviously also be sharing it with groups like this one so that we can kind of maximally get it out to you. If you don't hear something from us this week, please do reach out to me. I think my contact information is available, certainly can be provided to you. If not, reach out to me or the ALA will certainly have a copy of all the communication. If you don't hear something this week, please do reach out because we expect something to go out this week with more detail. In mid-August, we'll start, this could, mid to late August, we will start accepting actual invoices and the necessary documentation to enroll, especially for the assisted living facilities. I know you are not typically Medicaid providers, and so are not already enrolled in our systems. We'll be enrolling you as basically a vendor, so not necessarily as a medical provider, and that lowers some of the kind of paperwork necessary to actually get you in the system. So we just have a relatively straightforward enrollment process, and that we'll be doing that internally, asking for electronic funds transfer information and that kind of stuff, and that will be part of the communication that comes out this week, what you need to do to enroll. So we'll start enrolling people, we'll start taking invoices, and that should be this month, as soon as we can. So next slide. And this is sort of the back half of the program. So we'll start making payments as soon as we can, either late August or early September. It's possible we will have to make the first payments by check. There's typically about a 3-week lag between when we can get electronic funds transfer information and actually start paying electronically. So the first payment may be via check, but after that, we're hoping to do electronic. And we will start making payments. Then in October 31, that's again the end of the eligible expenses. So if you have expenses incurred after October 31, we won't be able to pay them. We are looking right now at whether we will likely say it's okay if you've incurred an expense in October 30th, but you didn't actually pay the invoice until November 2nd or something like that. We will probably still count that. We will consider that an eligible expense because the work was done, the cost was incurred, the thing was done in October, even if you didn't cut the check until November. But we'll have further guidance on that, but that's the current thinking because we have gotten that question. Final documentation will be due in December. We have December 1st here, and then final payments will go out by the end of December, possibly into January. If you're not aware, part of the reason for the program design here is that the CARES Act funding from the federal government goes away December 30th. Our ability to spend it goes away December 30th. So that's sort of the reason we've had to have this kind of early stop, time-bounded period where we can accept invoices and make payments. And so we'll be trying to wrap everything up by the end of December and may make some final payments after that, but that's the kind of reason for that cutoff. So with that, unless there are questions, that's what I have to say. Again, the kind of big news is this week we should actually be able to send out that communication that will say, here's exactly how you need to provide information to us to get enrolled in this. Here's exactly what you need to provide us in documentation for these invoices to be reimbursed. And here's how to give us your banking information so we can make payments. So more to come. We'll keep providing updates as we're able, but that's sort of the big news this week is to be on the lookout for that.
Thank you very much for that information. I know that we're definitely going to be watching to see what's the procedures as far as for the providers to get enrolled. And so we will be glad to share out information on our channels as well to any of the providers once it's available. And then if you would like Thomas's contact information, you can also reach out to me. Again, I'm Judy Hackler with VALA. So I do see that there is a hand raised by Carolyn Williams. So I am going to unmute your line, Carolyn. Carolyn, can you hear me?
Like you may still be muted, Carolyn.
Carolyn, your line is open if you have a question or comment that you wanted to share. Maybe you already answered her question, or if it comes back to you, then please let us know, Carolyn, and we will carry on and cover our next topic.
Great. Thank you, everyone.
Thank you so much. Next topic of today's discussion you may have heard about and should have heard about, and if not, you're going to hear about the Department of Labor and Industry adoption of workplace safety standards. So we have a special guest with us, and we are going to transfer the sharing of the screen, and Courtney is going to take over. So Courtney, it's available to you.
Oh, great. Can you hear me?
Yes, we can hear you.
Great, thanks. And thank you for the Assisted Living Association and all of you for your time. So glad to share what I can with you. And in the interest of time, just to leave time for your other speaker, I'll try to do about maybe 30 minutes and then leave time for questions and answers after my presentation or at the very end, whatever works for you. So does that work?
That'll work. And you're the last official speaker since we had everybody able up front, so you're good.
Okay, that's dangerous to give to a lawyer. So, well, first what I'll do is I'll try to share my screen. I am not the most technologically advanced person. Did it work? Okay, Good. And I'm weathering an electrical storm here with you, Judy. So if I go out all of a sudden, let Thomas tap dance for me. So it's great to talk to all of you. And so by way of just letting you know who I am, because I think it's good to know who you're talking to, and everyone has their biases in their background. So and we're touching on a lot of subjects that are there are a lot of questions, there are a lot of concerns, and so I just try to let you know where I'm coming from in addressing them. I served as Virginia's Labor Commissioner, the immediate past Labor Commissioner until several years ago, I guess 2013. It's been a little bit. And since then, and the Department of Labor and Industry enforces OSHA, or Occupational Safety and Health Law, in Virginia. And so I came from an enforcement role, and now I serve, I'm an attorney, and I'm a business lawyer by trade. And so I advise and represent employers in occupational safety and health matters. And so, and also another role that I have is that I actually am a member of their Safety and Health Codes Board that passed a new emergency temporary standard in Virginia with respect to COVID. And so, just so you know that I was part of that process. And so a lot of what I speak about is either from my experience as labor commissioner, or it's an outgrowth from the conversations on the Safety and Health Codes Board, or also in conversations in helping clients, employers, to deal with their employment issues. So that's where a lot of this is coming from here. So I'll go in advance here, and you have my contact information, because I think in the end it might be clear as mud. And if you're a little confused and you're wondering what it all means, that means you're starting to get it. So what I'd like to talk with you all about is the quick background and how we got here with the new standard. And then I'd like to just talk about what are the requirements for all employers. And then I'll talk increasingly about the standards that are more specific to medium hazard employers, which is probably most of you, and then high hazard and very high hazard employers, which may apply to a few of you, but I'll try to dwell on the subjects that I think have the broadest application, which is the requirements for all employers up through medium hazard. So let me give you a quick background. How did we get here? So I might geek out a little bit here on you, but just know that, so when we hear OSHA, or Occupational Safety and Health Administration, then that is the federal agency that enforces workplace safety and health laws. One thing about OSHA that a lot of people don't know is that in half the states have their own regime, their own safety and health regime that they run under a grant by OSHA. And so they have some flexibility, and Virginia is one of those states. And they're what's called state plan states. So within the Department of Labor and Industry, there's Virginia Occupational Safety and Health. So if you hear DOLE, Department of Labor and Industry, or if you hear VOSH, Virginia Occupational Safety and Health, we're talking about that state level OSHA enforcement. And so it should govern probably everyone in this call or in this meeting. It applies to nearly all private sector employers, and it applies to all state and local employers. What it does not apply to is federal government workers, military workers. If you happen to, I don't know that anyone here provides services on federal government properties, but if you were under federal OSHA jurisdiction, under those exceptions, then the old guidance that we've been familiar with since March, that we're getting from CDC, the Centers for Disease Control and Prevention, from OSHA, that guidance is really what we've been following, and you continue to follow that. If, like most people in this meeting, you're a private sector, or if you provide services for localities or the state, or you employ state or local employees, then you are under this new emergency temporary standard that was just promulgated by VOSH. And so the Safety and Health Codes Board, I mentioned that I sit on this board, and we approve OSHA regulations in Virginia. And so it's a citizen board. It comprises of representatives of employers, employees. I'm one of the employer representatives from the industry side. And so, so far, OSHA has really been enforcing the CDC guidelines and putting that forward as guidance and pushing that. Virginia, because we can have our own occupational safety and health program, then we incorporate the OSHA standards that we always have used for years. But in addition to that, we have some state-specific standards and regulations. And we can do that if they're at least as effective or at least as stringent as those under the Occupational Safety and Health Act. So that's why we have now a first in the nation emergency standard covering COVID-19. And that was just passed on July 15th. It was made effective on July 27th. And so it will be effective for 6 months, which means it's in place until January 26th. And the only way that it would not continue through that date is if it was replaced with a permanent standard. And I understand that the agency is working toward a permanent standard, actually not just relating to COVID, but also more to infectious diseases generally. So that's one thing that can interrupt the temporary standard if it's replaced with a permanent, or it can be halted if the governor lifts the emergency order, the state of emergency. And so that was an amendment I added as a member of the board, just to say this will live as long as the state of emergency exists, but not longer. So, but if the board will be inviting comment from you, from your association, and by all means, I think we would benefit. You'll see from the emergency standard, unfortunately, there are areas where I think the language is vague. It's sometimes not entirely workable, in my opinion. And some of this I don't want to necessarily give you my opinions on everything. I don't think that's what you need. But I think you'll find that some of it may be too vague or unworkable, or sometimes there might be some terms that are somewhat sound contradictory. And a lot of that, if it's a little frustrating for a lot of employers, because this was kind of put through very quickly without input. And so it's not a perfect standard, and there are definite imperfections in there. And that's why I say if you feel a little confused, it's because sometimes the terms are not well defined in the new standard. And so when getting your input in terms of what's workable and what is more clear to you into the permanent standard, it's going to be really important for us to get that from you before a permanent standard is considered later on this year. So let me talk about what are the requirements for employers under the VOSH jurisdiction. And that's just about everybody who's a private employer, state and local employers. So I won't hit on every single thing, but I'll hit on the things that I think diverge from the guidance that we've been getting through the middle of last month. So the way this standard is structured, it's structured to for employers that are deemed low hazard employers, those that are deemed medium hazard, high hazard, and very high hazard. And I'll talk about what those definitions are. And so there are also points where it discusses hazard levels for job tasks or hazard levels even for an industry. But when it talks about an employer that is deemed to be low or medium hazard, there's certainly a recognition that within a place of employment, within an organization, you can have job tasks that are low hazard and also medium and also high. And so keeping an eye on what is the big picture, what are we trying to accomplish? The goal we're trying to accomplish is to make sure that we're putting in place the protections for the hazard level that your employees are encountering. Then that's, as long as we're keeping that in front of us, then we should be in good shape with the standard. Notice OSHA doesn't deal with the safety of clients. It really deals with, or public safety, it deals with the safety of your employees. There are some, now of course your employees are impacted by who they encounter at work. So it could be visitors, clients, you name it. But ultimately, this is very employee focused in terms of what's required under this standard. So you have to have policies and procedures to enable employees to report COVID symptoms to you. Many of you are collecting statements from employees or screening them before they come on, sometimes daily, and that's great. And you also have to prohibit any known or suspected cases of COVID at your work sites. One thing that's interesting is the standard includes a requirement that employers use flexible sick leave policies. Now, I think many of you are familiar with the Family Medical Leave Act. For those who that applies to, or for those who it applies, there's the Families First Coronavirus Response Act. And so we know what those requirements are. On top of that, there's a requirement by the agency to have some kind of flexible sick leave policies. There's no definition to the term in the standard. I think what it means is that to the extent that you feasibly can work with folks in terms of they're taking sick leave to stay in their jobs to the extent they can, then you're in a good shape. But that's really what's flexible will be in the eyes of the beholder. And in this case, the beholder is the VOSH inspector or the agency. So you have to have a system to receive reports of positive tests within 14 days, and not just from your employees, which includes your temporary employees or your contract employees, but also subcontractors. And again, you're not responsible for the health and safety of subcontractor employees. They are independent contractors, independent of you. But to the extent that they can, your employees are exposed to them, and so their exposure to these subcontractors is something you do have to take into account because you are responsible for the safety of your employees under this act. So another thing that is different, before both hand washing and having hand sanitizer were viewed as best practice. Hand sanitizer was there if hand washing is not feasible or not possible in a workplace. Now it's actually required in Virginia. And so I did talk with the agency and I said, look, you know, we just had a shortage of hand sanitizer. We're spiking again, we might have another. And so I was able to add in the language, hand sanitizer is required where feasible. And so there is a little bit of a little wiggle room if you're not able to obtain hand sanitizer. So you're required to assess the risk levels, not only of your employees before they enter, but also suppliers. And for larger employers, that could mean you have dozens of suppliers coming in if you have a large workplace. If you're smaller, maybe not. But just being mindful of the hazards that are introduced by suppliers and visitors as they come is something that the agency wants you to at least take a look at. And finally, if any of you have an assisted living facility and you're the owner of the facility, then you do have responsibilities to notify if there are other employers on site, if you have contractors there, if you have others coming onto your site providing services, then you do have to notify other employers that are tenants of your facility, other employers that are there on a regular basis. So this is something that's new. Now, and many of you are familiar with the requirement of health providers notifying your local Department of Health of positive COVID cases. Now, all employers are required to notify the State Department of Health. The last I checked, there was not a mechanism provided to do so, but I'm glad to help you with that. I advise strongly doing so in writing and doing so in a way that you can document the date and time of the report, because you have 24 hours to report. And so sticking a letter in the mail in my reading of the new standard is not sufficient. And so I think email, fax, any kind of instantaneous kind of communication that can be recorded in terms of date and time is important. Also, there's a requirement if you have 3 or more positive COVID cases in a work site, then you have to report that to the Department of Labor and Industry, or VOSH. And so if you go to the website, there you can do so online immediately. And so that's already provided for you. That's a new requirement. I will say that that's a blanket requirement for all cases. So if your occupational safety and health person is used to reporting work-related injuries and illnesses, there isn't a restriction for COVID. You have to report all of them if there are 3 or more in that 14-day window. And again, you have to do that within a 24-hour period. So this standard requires that you do a hazard assessment for all the job tasks. I've had a lot of folks ask me, well, do I have to list all of the employees and all the job tasks and then provide the job hazard level for each of them? And so I really kind of massaged this language with the agency to ensure, and I also developed an understanding with the agency that what they're going after is not creating big, huge spreadsheets with all the employees and all the tasks and all the hazard levels in a huge spreadsheet. Really, you can accomplish this purpose by taking a look at job tasks more broadly and by what kind of hazards they encounter, and then just classifying those job tasks or even maybe those entire job descriptions at a certain hazard level as a group. So I tried to make this as workable for employers as I could here. And one other thing that, and I'll get into, is the requirement of preparing infectious disease preparedness and response plan. And so I mentioned that this standard was enacted on July 27th. And so within 60 days would be, I believe that would be September 26th. All right, so more requirements for all employers. If you hear about a safe harbor or good faith exemption, sometimes you might hear a section 10G mentioned by folks. So I think that section doesn't mean anything at this point. It used to be a safe harbor for employers if they were following CDC guidance, that they would be considered compliant. That language really got amended to the point where it doesn't really operate as a safe harbor if you stick with the CDC guidance. So we really do have to pay attention to this standard. We really do have to comply with its components. The non-discrimination, and this is anti-retaliation. You can't take an adverse action against an employee, and you can't do that if they raise or report concerns of COVID. That's not just if they report it to you or if they report it to OSHA, but also now there is a prohibition from retaliating if your employee goes to the news media or on social media. And so unfortunately, there are times when employees will make allegations about their employers on Facebook, and they might be correct and they may be completely incorrect. But regardless, that's generally going to be considered protected activity at this point in Virginia. So employees can voluntarily wear personal protective equipment beyond what is necessary or you deem necessary. If someone comes in with an N95 respirator on, they may do so. And then I think the work refusals, I don't think the law has changed on that. Basically, if an employee has a reasonable work refusal and it's made in good faith, it's not just a bunch of people trying to take a couple of weeks off of paid leave, then no, they can't just go walk off of work. And so I understand there are a lot of people who are afraid of COVID, and rightfully so. It's a pandemic. It's affecting us all. But it doesn't mean that we all get to walk off of work. What it does mean is that while we can't eliminate the risk, as managers, we manage the risk. That's what we're trying to do here. And creating a COVID-free bubble at your workplace, I've yet to see one. If they have people in it, I don't see it how it can be, but we can manage the risk to the point where it's something that is reasonably safe for workers under the standard. Now, I'd like to talk a little bit about the low hazard employers, just because this is the base level stuff, and then you kind of build up on it if you get higher hazard. And so low hazard employer is one in which, well, two things. One, there's no required contact within 6 feet of people who have a known positive COVID test or suspected case because of their symptoms. And also, it's low hazard if you have only minimal contact with other people. And so if you are socially distanced and you can take the normal practices of hand washing and hand sanitizer, and you've got the masks going, especially in areas where you have multiple people, then that should be low hazard. Even if it's, if you have somebody, the people kind of cross by each other in the hallway from time to time, then that's minimal interaction. So, and there are different ways you can accomplish it, not, as I mentioned, by the face coverings. The agency suggests remote delivery of services and products. Maybe you can separate people by time and space by staggering their shifts, or putting people in different parts of a facility. So let's jump into medium hazard. And I think this is where most of the folks in this meeting are. So for low hazard, think about your typical office where people are sitting in separate cubicles or separate offices. They're not on top of each other. Now when you get into medium hazard, and I think a lot of you are here, especially for caregivers. So if you have more than just minimal contact within 6 feet of other people as part of your job duties, the standard doesn't define minimal. CDC has what I think is the best workable standard that I've heard, which is the 6-15 rule, which is within 6 feet of someone for 15 minutes or more. And so if it's just a brief meeting or brief encounters, but by and large you're at least 6 feet apart, then that's low hazard. If that, on the other hand, especially if you're giving care to people, if you're working closely with others, maybe I've had parents who had caregivers and there's lifting or providing support, then you are working within 6 feet of others on a more regular basis. That's medium hazard. And so there are a number of different industries that the agency has said, well, just from the 6,000 foot view, we think that these industries these workplaces tend to be medium hazard. And so you'll see those types of places where you have more interactions. And so I believe it included healthcare, healthcare settings that don't, you see at the bottom of the screen, that don't involve exposure to people with known or suspected cases. Now, unfortunately, we're increasingly seeing that there are centers in which there are outbreaks. And in those really unfortunate circumstances, then perhaps what might have started as a medium hazard workplace might then become something that's more high hazard if your workers are providing care to people who you believe or know have COVID. So what are the requirements now if you're medium hazard? Well, if you can have people work remotely, and of course a caregiver can, but to the extent that you have folks who can do some administrative tasks remotely, then that's, when feasible, then the agency says you must allow people to telework or have them work in staggered shifts so they can work apart. To the extent that you can eliminate meetings, personal meetings, or travel, but rather meet virtually like we're doing now. When feasible, you're putting up physical barriers that are effective at preventing spread of COVID. So you may have seen, for example, the plexiglass shields or the shields that are drugged to the ceiling or come up from the floor. And so, and also a real big one is reconfiguring spaces where people congregate. And now you may have to think not just about the break room or if you have a small cafeteria where people congregate, but maybe even where clients congregate and your employees work. You have to go and reconfigure it such that people are at least 6 feet apart from each other where they're congregating. and marking the floor or separating the chairs and the tables, and then putting up signage indicating, look, if this was socially distanced, this is the new maximum capacity of this area. Elevators, waiting areas, you really do have to kind of walk through and see, okay, where are you congregating, and then space them out accordingly. Now, for employers who are medium hazard, also high and very high hazard, they have to prepare an infectious disease preparedness and response plan. There is an exception that was strongly debated, but I'm glad the exception's there, for employers with 10 or fewer employees. So if you have 10 or fewer people, it's a very small operation. I interpret this to mean number of employees in Virginia, not necessarily by work site, but not necessarily elsewhere. But if you have 10 or more, if you have 11 or more employees, then you have to develop this infectious disease plan. So it includes a number of elements, and so it's going to include, you have to designate someone to implement it. You have to engage your employees, because, and I will tell you, I have always counseled engaging employees and getting their input in terms of what the hazards are and how to address them. It's a smart employer that does that. You tend to get more buy-in, I think, if you ask employees to be a part of this process, rather than just kind of get the word from top down. You have to take into account whether employees have other jobs. And so you might have someone who is fairly low risk in their daily job duties, but let's say they volunteer as an EMT on the weekends or in the evening. Well, then you do have someone who may be higher hazard through another job. And so it doesn't mean they can't necessarily work in your workplace, but you do have to take that into account in terms of how you abate or take care of those hazards, how you fix the hazards. So you have to consider also their individual risk factors. I do not encourage employers to run around and ask everybody what their medical conditions are. That could violate HIPAA. There's the Americans with Disabilities Act. Especially if you start to treat them differently, if you start to record that information, then you're responsible for keeping it secure. And also, there's information that you may not necessarily be able to ask. But without asking what people's health conditions are, you should encourage employees to let you know. If there are restrictions, health-based restrictions, let me know. And you could also get a note from a health provider or their doctor saying, not necessarily whether this person has high blood pressure, asthma, or whatever, but it could say, look, this person has these certain restrictions for their workplace, and to take that into account. And then you can kind of work with them in an interactive process to find a reasonable accommodation that works both for the employee and for you, that will help them to accomplish their essential job functions. And if you use that process, you'll be fine. And also, the individual risk factors may not necessarily be health related. It could be that they have, say, an immunocompromised family member back at home. Then, there may be certain circumstances. And so if it's feasible, maybe shifting that person into another job or changing their job duties or changing their job setup can help you to make them successful at work. It's not a blanket, we have to bend backwards to accommodate every request out there. If you did, it could get pretty ridiculous pretty quick. That's not what this is. What it is, it's an interactive process in trying to find a reasonable accommodation that works both for the employee and for you. And sometimes I've dealt with situations where there really isn't a middle ground where that works for both. And so occasionally you might have an employee who no longer can accomplish their job as it was before the pandemic. That does happen. But it's something to just be extremely mindful of in trying to accommodate employees, just to be on the safe side in terms of liability. So, and also the response plan is supposed to include just your backup. How do you operate if your supply chain goes down, if you have delayed deliveries, if you need to cover for people who can't be at work, that kind of thing. There are other requirements for medium hazard employers. There's you already pre-screen people as they come into work, and you have to provide face coverings to visitors who have suspected cases of COVID, and if you have employees who can't social distance, then you provide face coverings. And so one thing in terms of the infection prevention, I mentioned a lot of people talk about cleaning only. And cleaning and disinfecting, as many of you know, are very different things, especially now. And so not just keeping an area clean, but there's a list of disinfectants, and it's linked from the Department of Labor and Industries website. And it links to the Environmental Protection Agency. It has a list N, which is a list of disinfectants that are effective against COVID. So something that's either on that list or on the labeling says that it's effective against COVID would suffice. And there has to be a regular disinfection schedule. The agency and the standard, they don't say how often, but I'll tell you what was on the minds of the agency and the board members. If you have shifts and people change shifts, then some kind of disinfection between shifts. I have one employer that had 2 shifts a day, and they wanted to do an overnight disinfection. And to tell them, look, you know what, in between shifts, you really have to disinfect. Now, that doesn't have to be done by a separate service. It can be done by employees as part of their job duties, at which point you have to, of course, provide disinfectant and train them. But the idea is that if you have a change of shift, or if you have employees who share equipment, that in between change of employee, we're halting the virus and we're disinfecting. That's what's on the agency's mind, and that's if you keep that in mind, then you'll be on the right side of the standard. So you have to have a system to identify and isolate people with known or suspected cases of COVID, and you have to have a plan to address subcontractors, even those who are not your employees, but may come in contact with your employees before they can come into your work site. So, and also that we are accustomed to, many of us are accustomed to personal protective equipment under the the ongoing OSHA standards. And so I think everyone here would fall under what's called the General Industry OSHA standards. It's section 1910 of the regulations. And so there may be respiratory protection or gloves or you name it, just depending on what you're encountering, maybe face shields. There are above and beyond those requirements. Those requirements have been around, many of them have been around for 40 years. This is new. It's the novel coronavirus. By definition, it's not in the PPE standards for general industry because nobody thought about novel coronavirus. It never existed. So there may be additional PPE required now that nobody dreamed of needing before this year. You have to have a written certification to verify that you did your workplace hazard assessments. The agency has a link also to guidance documents and also some templates. And so you can use that to help guide you in doing your hazard assessments. And then finally, if you are the owner or you control the facility or the building, then you are responsible for ensuring that the HVAC system is compliant with the manufacturer's instructions and also with ANSI and ASHRAE standards. Another big thing that's required for medium hazard is employee training. And that has to be done within 30 days of the enactment of the standard. That's kind of really quick. That is the 26th of this month. So it can, if you're low hazard, there's no training requirement. There's a 3-pager flyer that you can distribute to employees and just instruct on social distancing. Now, if you are medium hazard, then there is a training requirement. And so it has to include not only what's in your infectious disease preparedness and response plan, It also has to include what are employees' rights. It has to include the CDC guidelines. It has to include the requirements under the standard. And it has to include retraining. That's another area where this standard is not at all specific. Retraining as necessary. So if the science changes, let's say we have a vaccine or something and we retrain on how to handle that situation, or let's say there's a big change in job duties or in how the workplace works or how they encounter the hazards at the workplace, then we retrain then. Or if people don't seem to get it, or if people are confused on something, then as needed, then the agency does require retraining. With that, I'll just share briefly, this won't apply to as many folks, but maybe a few, the high hazard and very high. And high hazard really, this is dealing with situations where you are expected to work within close proximity of individuals who suspect of having COVID or positive COVID tests. And so in these cases, and we're talking first responders, we're talking healthcare, emergency room providers, those types of situations where you're really working with people who have COVID or you suspect to, then there are certain requirements. So this could be mortuaries, you name it. So it has some of the requirements you'd expect, like signage to report symptoms. Maybe there's an airborne infection isolation room if you have patients with COVID, respiratory protection. There's even a requirement for psychological and behavioral support for these folks because they're just in such a stressful situation. So I'm only going to touch on that briefly and then open up to questions. And so if I could, if you'd like to ask any questions, then this time is yours to do so.
Remember that if you are on the telephone, you can use *6 to unmute your line, or if you're on the computer, you can also raise your hand as a button, and then we can unmute your line so you can speak audibly if you have any comments or questions. Unfortunately, assisted living communities in Virginia have not been immune to COVID, and so I know that there are quite a few communities that have experienced active outbreaks with residents and even staff members that have had positive tests for COVID. And so there are some still out there that have not had any positive cases, and we pray that they continue that way. But so I can see the providers being a mix between the medium and high hazards as far as what the situation is at the time. And so the reopening for visitations of outside family members and guests is definitely something that's on the mindset of the providers. So we appreciate the information you provided on that. Are there any questions from the attendees with regards to the labor concerns and information that was shared? I know that we did have some comments and questions that came through on the chat with regards to funding, and so I'll just touch on those real quickly just to make sure that those are available. So we did have questions about where the applications be online available for the funding. And yes, they will be made available online by DMAS, and they're going to be sharing it out to multiple channels. I would expect that there also might even be put on some of the Department of Health long-term care websites just to try to get more resources available. We will also, as VALA, share the information out to our distribution list. DMAS has worked with the Department of Social Services to get the listing of providers that are licensed, and so they have the contact information on that. And so they will also be working with other agencies such as VALA to share the information. Today's recording was recorded by VALA, and so we will be posting that on the VALA website of today's sessions. And if you have anyone that you think might benefit from hearing this information, then they will be available to view by other individuals regardless of whether they're registered for today or not. You can also share that out to them. And then only those that were pre-registered for the live webinar and were able to join us for this actual live portion will be able to actually get the CEU credits. So one last chance for any questions, any comments, any last minute thoughts from our attendees or from any of our speakers or guests. I do not see anything in the chat, and I don't see any hands raised. But I do want to thank you all for joining us today. We truly appreciate it, and I apologize for the electrical glitches that you may have heard, as we did have quite a bit of lightning around us. So thank you for bearing with us. And again, you have my contact information on the screen. For those that are on the phone, I am Judy Hackler with VALA, and my email address is jhackler, JHACKLER @valainfo.org. So if you have any questions, or if I can help you, or if you have any last minute thoughts that you want to reach back out to Courtney or to Thomas after the call, please let me know and I'll be glad to connect you together. So thank you for being with us, both Thomas and Courtney. Appreciate it. And we look forward to seeing you on a future webinar as well for more information. Thank you.
Thank you.